So nice. Can we stay for an hour?
Okay. Thank you very much, Senator.
I apologize for
Well,
being late.
this is the last week of session.
Yes, of course. And we're all still semi-standing, so this is a good thing.
So, we have a quorum. We're all anxious to hear from you, Senator. I know you've done a tremendous amount of work, as have your co-authors, or joint, I guess, principal co-authors, Ting and Gray.
Yes.
And I want to thank you all for all of the hard work you've done, and for all the stakeholders in the room being part of this process. You've all gotten us to the point where we are now. I am extremely concerned that we get this to the floor, and the reason is, whether you're for a take-back program or not, we can all agree having 40 different take-back programs is not a good idea. I can also tell you that some of these programs are terribly ineffective in the various counties, particularly in Alameda County, which was the first one to go. I can't tell, well, I've looked up where their sites are, and they're not really easily available to anyone. So I hope one of the things we can get here is just a system that works better, where people know where the pickup sites are. Having a statewide program is going to be a big help in that. And Senator, please present.
Well, thank you, Mr. Chair and members. This is a bill I've been working on for quite some time, and I'll tell you, when we started, we tried to get all the stakeholders in the room together. That alone was a challenge. By the end of the first hour, I thought we were going to have to call 911 because we could not get agreement on anything. And since that period of time, as you indicated, there are a number of different communities that have created their own programs. So we now have a veritable hodgepodge of programs. I believed, and I think everyone who stepped up believed we could get to yes on this. And so this is yes. It's not a perfect yes, but it, I believe, will move us forward to create programs that, as you indicate, are effective, where people know where they can go, where people know what their responsibilities are. And so I'm very delighted, a little surprised, but very delighted we actually have a final product for you. This was truly like herding cats, but we're all recognizing the importance of coming to an agreement on this, both for drugs and for sharps, so that we can get rid of these, we can dispose of them as safely as possible and effectively. So this is a measure that creates a comprehensive statewide producer-paid take-back program for home-generated pharmaceutical drugs and medical sharps. The bill will set a statewide program under which California consumers will be able to safely and conveniently, and this is important, if it's not convenient, they won't do it, and conveniently dispose of medical waste and unused medical products, giving solution to a problem that all Californians know too well, and I would suspect each and every one of us. If you've individually been through a health issue, you have family who's been through it, at the end of the day, you're left with medications that haven't been fully consumed or that have expired. What do you do with them? Or sharps that are out there and have the potential to be dangerous by the very nature of their being. So I'd like to focus on recent amendments which were taken to address agency and stakeholder concerns. I first want to thank, as the chair mentioned, staff and my colleagues in the Assembly. This has been truly a labor of love and will to get to this result. And we have some of those people sitting with us today, and I want to thank them, and also thank staff who were thrown into this kerfuffle, probably without realizing what they had signed up for. So this is a bill that these amendments address these stakeholder concerns that the chair had indicated were of concern to him. Specifically, I'd like to point out the robust tiered definition of what a covered manufacturer is, which has been crafted to address the concerns of not just industry, but of Cal Recycle as well. We've also worked to create a workable framework to handle the safe and comprehensive take-back of needles, of these sharps, but authorizing Cal Recycle to approve a mailback, by authorizing Cal Recycle to approve a mailback-based stewardship plan that focuses on readily available containers that, free of charge, will be available to any consumer who needs them. We have also taken additional amendments to make sure all agencies involved have the authority they need to consult with one another. It's often incredibly frustrating, and sometimes I'm incredulous at the fact that these agencies don't even think to talk with each other or don't want to talk with each other. So we have encouraged and taken amendments to give them that authority. We've taken several amendments to exclude specialty products or animal products, which I know have been concerned, that are separately regulated by other areas of state and federal law. And this bill is a product of months and years of stakeholders coming together, strangling each other, coming back together. This has been a family fight of great proportion, but at the end of the day, we all recognize the importance of getting to yes, and I want to thank my principal co-authors for their work as well. I thank the chair for his involvement, and here with me today is Jason Schmelzer on behalf of the California Product Stewardship Council. When we first started talking about this issue, he had hair, and and right now, he will be here to provide assistance with any questions the committee may have. And with that, I would respectfully ask for your aye vote.
Thank you, Senator Jackson. I've been running around with my hair on fire. That's what happened. Also, obviously, want to thank the two principal co-authors, Assembly members Ting and Gray. All three members and their staffs were absolutely vital to this process. And Mr. Quirk, Mr. Chairman, I want to thank you for your comments last time we were here. I think what it did is it gave us the opportunity to expand the circle somewhat and reach out and talk to folks who still had issues that we needed to resolve. And I'm fairly certain that we've done that to the best of our ability, in no small part with the assistance of your staff. And folks on this committee. So thank all of you for your contributions to this. I'm going to put my eyes back on for a second, if you don't mind. A few notable changes to the bill. One, we completely restructured the sharps portion of the bill. We sat down with the industry and we worked out something that frankly makes us all not super comfortable, but we feel like we've bootstrapped it with certain provisions on our side. They seem to be more comfortable with it. They'll be here obviously to talk about it themselves. But we did kind of as asked by this committee. We reconsidered and restructured that portion of the bill, and thank you for your assistance with that. We enhanced the program promotion, to your point earlier, so people know about the program. People know where to find the kiosks. People know how to get their mail back containers and where to send them. We have done significant technical cleanup, again, in no small part, thank you to your committee staff. And we took a host of amendments to address other concerns from other folks. We harmonized timelines. We did a lot of things in the bill that bring us to where we are today, which is with a good bill that's taken a lot of work by a lot of people that will have a great public impact on an occupational safety and health level, on a public health level, and an environmental level. So with that, I would simply respectfully urge your aye vote.
Thank you.
Thank you, Mr. Chair. He had hair and I had no gray hair. My name is Oliver Rockroy.
You still look pretty dark-haired.
There's a few. They're recent. Oliver Rockroy with the California Life Sciences Association. We have the unique privilege of representing both drug and sharp manufacturers. The last time we were before this committee in June, we had a position that required some amendments, and I'm happy to say that in the last 6 to 8 weeks, thanks to the author, her staff in particular, the two principal co-authors, the committee staff, and the willingness of not only the industry but all the stakeholders involved to really move the ball and get to a position that we could all be comfortable with, knowing that there are some certainties if this bill does not move forward. Those certainties include local ordinances, additional local ordinances at the county level, some of which are far more confusing than this bill. We think a statewide program with at least a uniform set of rules, with the understanding per the recent amendments that a drug and a SHARP are different products and are treated differently under this bill. Therefore, we're very happy on behalf of our membership to urge this committee to move the bill to the floor and then to the governor's desk as quickly as possible. So with that, thank you very much.
Very good. Well, I guess I'll ask for others in support.
Mr. Chairman and members, thank you. Fielding Greaves with the Advanced Medical Technology Association. We want to thank the authors and their staffs for all of their time working with us, working through all the issues. We represent the medical device industry in this. We have remaining objections to the local reimbursement piece and some of we have technical concerns with the provisions of SHARP's containment at the point of sale, but we are really, really pleased with the compromised product that we have here today, and urge all of you to vote aye to move the conversation to the floor. Thank you.
Mr. Chair, members, Justin Milan on behalf of two groups, the local environmental health directors, and they've been long-time supporters of this. It's well overdue. And also on behalf of the Natural Resources Defense Council, we urge aye vote.
Teresa Berkovich on behalf of Clean Water Action, Heal the Bay, and Alameda County Waste Management Authority in support.
Jennifer Snyder, on behalf of the California Retailers Association and the National Association of Chain Drug Stores. We have moved our position from opposed unless amended to neutral. Very much want to thank the authors and their staff for working with us. Our main concern centered around the definition of covered entity and the concern of how that could implicate retail pharmacies, their licenses, and especially patient access to prescription drugs. The way that we compromised on that definition, we can't say that we're completely thrilled with. We still will be interested to see how the regulatory process looks to implement that definition of covered entity. But for now, we are comfortable with a neutral position and look forward to working with CalRecycle and continuing to work with the authors on implementation. So we thank you very much.
Thank you.
Faith Conley with the County of Los Angeles Board of Supervisors. We have a support and concept on the bill. I want to thank the author as well as the stakeholders and sponsor for working with us on amendments over the past couple months.
Nicole Wortelman on behalf of the San Bernardino County Board of Supervisors in support.
Chuck Helgett on behalf of Republic Services in strong support.
Melissa Immel on behalf of the National Stewardship Action Council, the Solid Waste Association of North America, and the Western Placer Waste Management Authority in support.
Good afternoon. Jason Bryan on behalf of the Western United Dairymen. Appreciate the author's work to create clarity for animal agriculture. We are in support of the bill. Thank you.
Good afternoon, Mr. Chair. Justin Oldfield with the California Cattlemen's Association for the reasons stated by Mr. Bryant. Appreciate the author addressing concerns related to animal agriculture. We are in support. Thank you.
Got to change that. Dennis Albihani on behalf of California Grain and Feed and Associated California Egg Farmers. We also support. Thank you.
Mr. Chair and Member, Sylvia Solisha on behalf of the Board of Supervisors for the counties of Butte, Humboldt, Mendocino, and Shasta. And I'd also like to testify on behalf of the City of Santa Monica. Thank you.
Mary Pitto on behalf of Rural County Representatives of California in support.
Good afternoon. Kiara Ross on behalf of the cities of Pasadena, Stockton, and Sacramento, all in support.
Kara Martinson on behalf of the California State Association of Counties in strong support.
Good afternoon. Erin Evans on behalf of the League of California Cities in support. Thank you.
Michelle Gibbons with the County Health Executives Association of California, representing local health departments in support.
Nick Lapis with Californians Against Waste in strong support.
Gianna Situde on behalf of the Alameda County Board of Supervisors in support. Thank you.
Mr. Chair, members, Alex Hawthorne with the California Hospital Association. We did have an opposed unless amended position on the bill. We asked for hospitals and clinics to be removed because of the unique circumstances of many of them. We do appreciate the amendment. We'll be removing opposition. Maybe some technical issues next year to work out, and obviously my members are important parts of communities and may play some role. So removing opposition, look forward to continuing the conversation next year.
Genevieve Abaddon on behalf of Surfrider Foundation, Center for Oceanic Awareness, Research, and Education, Plastic Pollution Coalition, Seventh Generation Advisors, and the Five Gyres Institute in strong support.
So I'll note the Hospital Association wanting to work on additional, and I'm sure we will have other organizations that want to work on this. Do you want to address that before I ask for opposition, Madam
Certainly.
Author?
There's no doubt now that my two principal co-authors are here, and they can certainly feel free to pipe in. I'm sure we're going to be tweaking this for a period of time. The key has been opening this door. We have an amazing group of often disparate sources who have come together in support. This is the first step. It's a big first step, but it is a first step, and I anticipate we'll be hearing and having to make adjustments going forward in the future. It won't be the first time with legislation that really moves the needle, but I'm literally and figuratively, I guess. That was a bad pun. I do think that this is really a very major and a very positive step forward.
All right. Before I ask for opposition, Assemblymember Ting and Assemblymember Gray, would you want to say a word or two?
Certainly. Thank you, Chairman, members. I'd like to thank the principal co-authors for their work in getting to this point. You know, this issue's been before the legislature the entire 18 years that I've been around the state capitol, and so coming to some movement and solution going forward is quite a accomplishment, and we shouldn't understate that. And certainly for every gripe, you know, in this bill, there's a win. It required us to put aside, you know, kind of the approach that we too often take here of ideological purity, and rather sit down and actually negotiate and compromise and bring legislators together who bring differing points of view and perspectives, and do the long meetings. And over a couple of years, frankly, we were able to come to a place where I think there's certainly a lot more good, and there may be some, you know, remaining challenges that we have to address going forward, but I certainly am committed to ensuring that we work with the committee and others to make that happen, and I think my principal co-authors are as well. So thank you for the consideration today.
Thank you.
And let me just thank you, Mr. Chair, your staff, my staff, I know the senator's staff, Mr. Gray's staff, I know they put in hours and hours and hours, which is what it took to get this piece of legislation done. They did an incredible job. I think, as Mr. Gray said, that this issue has been around for quite a while, but it took, you know, our collective staffs to really bring all the stakeholders together to get us to this place. And as you can see, we're at this fairly extraordinary place where we have governments, and not only governments, but governments that don't really aren't necessarily aligned together agreeing. You have industry agreeing. You have industries that traditionally have been very much opposed to these types of measures really kind of coming together in a common solution. And this is, for me, the culmination of three years of work. I know longer for the senator, longer for Mr. Gray, but I think it's amazing that we're able to get to this point. So I just personally want to thank all our staffs. Thank, again, the committee staff here for really getting this across the finish line. Thank you.
Yes, thank you. And I've heard from stakeholders how important the work of my chief consultant has been, even after the first set of amendments, going through it line by line to find other things that needed to be added. And I really want to thank my chief consultant very much for all his hard work. All right, we now need to hear from opposition. It's fine. You know, we're here to do our jobs.
Sorry for having my back to you, Mr.
No one with a knife back there, honest.
No, that's reserved over there. Mr. Chairman and members, thank you very much. And I would absolutely concur.
Would you introduce yourself?
Oh, I'm sorry about that. Brett Michelin with the Association for Accessible Medicines. The AAM represents the generic and biopharmaceutical manufacturers. And wanted to start with the fact that, yes, your staffs combined have done an immense amount of work, and that's certainly appreciated. The concerns that AAM has is based on the fact that generic pharmaceuticals, and I'm primarily going to be addressing the pharmaceutical side, not necessarily the sharp side. since those portions were somewhat separated. Generics have saved the state of California in 2017 alone $23.4 billion. That's throughout the Medicaid system, the Medicare system, cash-paying patients, and commercially insured patients. The unfortunate fact of this bill is that generic manufacturers are going to be primarily paying for the cost of what is a very broad, very prescriptive bill, and that likely will have the result of increasing the cost of what are right now what is supposed to be and has proven over the last decade a depreciating market and one of the only depreciating markets within healthcare. Generics have depreciated 7% annually. This bill has the effect of reversing that, or potentially reversing that trend, and definitely slowing that trend. We have requested two separate sets, two amendments that we think would help address the costs in the bill, both to help spread the cost, the operational and programmatic costs across the supply chain. Generics generics in this bill are required to cover the costs for essentially any covered entity that wishes to join. Even once a program has been approved annually by CalRecycle, any covered entity is able to come and request to become part of the programs. That means entities such as Walmart, CVS, any other large chain drugstore, which are significantly larger corporations than most generic manufacturers, can become part of the program with the entities paying for the program covering those costs as well. We don't believe that is appropriate. Generics right now, when we're discussing the supply chain, receive approximately 1/3 of the revenue of the distribution of drugs. That means those other entities that we're going to be covering costs for are taking 2/3 of the revenue, yet this bill is requiring us to cover the entire costs again. The second aspect that we've discussed and would have liked to have seen covered in the bill is the fact that there is no definition of or acceptance of revenue versus volume in the bill. Generics, again, $23.4 billion saved in 1 year alone. This bill ignores any consideration of revenue. We would request that there be something that requires through the regulatory process that revenue versus volume be addressed in the amount of how these costs are being distributed. Currently, there is one program that's in existence that we were part of, admittedly, part of starting, but that program also divides costs based on volume, not on revenue. Generics are 90% of what is prescribed in the state and nationally, yet we take 23% of the revenue. Brand manufacturers, on the flip side, are 10% of what's prescribed and take 77% of the revenue. Yet this bill and the programs that exist would put the cost primarily on generic manufacturers. In the analysis, this bill...
Could you take about one more minute? You've gone
Sure,
about
absolutely.
4.
I'm just about done.
Okay.
In the analysis of this bill, it talks about the increasing cost of drugs as one of the scopes of need for this bill to show that the amount of drugs out there are going up. Yet the bill completely ignores the cost of drugs and the lower cost drugs when the programs are being asked to be paid for. There are other ways of achieving some of this. Education of both prescribers and patients. Patients should be taking the drugs that are prescribed. Prescribers should not be overprescribing. That's a pretty basic fact. We believe through better education and better knowledge, better adhering or recognizing that CalRecycle already has, and there are over 600 take-back centers already in the state. Expanding those should be done. Expanding knowledge of those should be done. But having an overly prescriptive and very burdensome bill focused primarily at generic manufacturers, we don't believe is appropriate. And those are the reasons that we are asking for a no vote, but are still officially in an opposed unless amended position. Thank you.
Thank you very much. You've made your point very clear. Other next speaker?
Thank you.
And try to keep it to 5 minutes.
I will be less than that.
Good.
Thank you, Chairman Quirk, members of the committee. My name is Leah Lindahl. I'm the Senior Director of State Government Affairs for the Healthcare Distribution Alliance. We're a trade association representing primary pharmaceutical wholesale distributors, and essentially our role is to ensure the 17,000 hospitals, pharmacies, and points of care have safe and timely access to the medications they need to treat their patients. We are here, unfortunately, in opposition, unless amended, to Senate Bill 212. And HD and our member companies really stand ready to work with the supply chain partners and government entities, ensuring that there is a safe and secure way to dispose of unwanted medication. We appreciate the ongoing work of the sponsors and their staff, as well as the committee staff, for helping get the bill where it is today. But we do have outstanding concerns with the language based on essentially the ambiguous definitions entailed and then the unfettered regulatory process. In the current definition language, covered entity provides a vague definition requiring several entities to potentially be liable for the program, and the language does not offer definitions to what constitutes a manufacturer, nor does it provide guidance on what qualifies as someone being in the state. That scenario could result in an inefficient way of raising revenue and ultimately add unnecessary costs to the healthcare system. We appreciate the additional language that was added to require a regulatory process to establish parameters around that definition, but we believe there needs to be specific language on how the department will enforce that tiered definition. The pharmaceutical supply chain is vastly different from any other industry currently operating a stewardship program within the state. It's one of the most highly regulated industries, so there are different issues depending on which industry that the CalRecycle has been working on. And ultimately, wholesalers, distributors, and other entities in the supply chain who facilitate the delivery of products should not be penalized for noncompliance of the actual manufacturer, nor utilized as an enforcement mechanism on behalf of the state. HD and our member companies stand ready to work collaboratively with CalRecycle on the regulatory process, as well as other stakeholders, to ensure that this program is viable for the state. So thank you.
Thank you very much. What sort of companies are members of your organization?
Sure, wholesale distributors. So we have our
okay.
Yep.
Got it. Thank you.
Absolutely.
All right. Others in opposition? Okay. So now we go to the committee. Any questions, Madam Vice Chair? No? Mr. Bro, go ahead.
Thank you, Mr. Chair. First, Senator and my colleagues on this side of the House, appreciate your effort in working with the opposition to get to an agreement on this bill. A couple of comments and a couple of questions. So first, my home at Dana Point, we have a program. There's a box at City Hall that folks can drop off needles and use drugs and things like that, and then a deputy sheriff will take them to Santa Ana and ultimately to Long Beach to be incinerated. And the city's role is to, one, provide a place, but two, market it to get the information out. So that's the way we do it locally. But my one question is, since we're dealing with needles and prescription drugs, why CalRecycle? Maybe a more medical board might be a proper place to come up with these regulations. Why was CalRecycle chosen?
Well, CalRecycle actually has been doing recycling programs, so they are the most logical on the ground.
Just a second. Could we have your experts come up here and with, I'd say we need to get another chair, but Mr. Schmelzer and...
Sure. But I can't answer the question.
You can answer the question. I just wanted to make sure we had some of your experts up here.
Mr. Ting's an expert.
So Cal Recycle is, in California, the foremost expert on this kind of response, the producer responsibility. We do cans and glass and all this kind of thing. And if you just substitute sharps and drugs, obviously the goal is to adequately dispose of these products. They are the experts in this particular field. We've worked with the Board of Pharmacy and the Department of Public Health, and they are also very integrally involved in this whole process. So Cal Recycle, they're the experts in this area, and working with, as you mentioned, medical groups, Department of Public Health and Board of Pharmacy are the sort of the, I guess, the specific experts. Cal Recycle knows how to do this kind of management of unused products and the need to dispose of them safely and appropriately.
Okay, that was my concern, that some of the medical expertise, because these aren't, plastic bottles or aluminum cans.
Correct.
And frankly, Cal Recycle, I think, all my places are closed. We can't even turn in the cans. So I just had a little concern there. My second and final question is, was actually for Mr. Ting. Some folks came into my office and described the issue you have in San Francisco with needles. And is your situation a medical situation, or is it folks that are using illegal drugs and throwing the needles on the sidewalk and things like that?
I don't have exact data, but if I had to guess, it is more people who are given needles and then not disposing them properly. It'd probably be more the latter, right? And so I think that's why it was agreed upon to do a mail-back program with Sharps. Obviously, so for our particular example, which is how I got involved in this issue, it's not just mailing back the Sharps, but really a lot more education and having a lot more sites for people to dispose of. It's become quite an issue in San Francisco.
Yeah, no, that's what I was told. A concern is that we're asking private sector companies, to pay for drug users' needles that they're not to be disposing of properly, but that's a concern. I mean, you might want to look at, maybe on stop signs, putting boxes on stop signs, little things like that. But I'd love to work with you on this issue.
No, I think that's a point well taken. That's why we worked very closely with industry for over 3 years to reach this point of producer responsibility. That we've got industry buy-in on that. But you're absolutely right that we do need to be more proactive in getting this type of product off the street. I know our public health department has a number of places where Sharps can be disposed, but oftentimes you have just improper human behavior. They're not going to walk the extra 2 blocks. They're just going to put it on the street, right? So that's the bigger issue we need to solve.
Thank you. Then Dr. Arambula, and then Mr. Marisucci.
Thank you, Mr. Chair. I wanted to start by thanking the author for hearing us in the last committee hearing and making amendments that many of us were asking for. I specifically am quite excited about the amendments removing agriculture from this bill, and just wanted to thank the author for doing it. I'm happy to move this bill today, Mr. Chair, when the time is appropriate.
Well, go ahead.
I move this bill. But I do want to raise a concern if I can. Currently, we're facing some medical shortages, inability to receive certain medications into certain communities. I hope that adding more regulatory burden will not exacerbate that problem, and we'll be looking towards the implementation of this bill to make sure that people's ability to access generics and brand name pharmaceuticals are things that we can continue. While I appreciate the scope and severity of this problem and the need for this fix this year, I think it's important for us as we implement this that we're not forgetting that at some point we have prescriptions that need to be filled as well. So with that, happy to support this bill, thank the author and co-authors for bringing it forward, and look forward to its implementation.
All right. Mr. Marisucci.
Thank you very much. I also will be supporting this bill moving forward, but I wanted to raise some ongoing concerns I have, specifically the definition of covered entity in the bill. It seems to be rather broad, and it has the provisions, according to the committee analysis, of a covered entity. If there's not a manufacturer for a covered product, then the covered entity would be the distributor of the covered product sold into the state. And it just seems to me that the basic EPR principles that it should be the manufacturer rather than the distributor that would be held liable for or responsible for the this effort. But I wanted to ask Senator Jackson.
Well, I certainly agree that it should be the manufacturer. Practically speaking, some of these medications aren't made here, and to go after them is very, very difficult. Part of this, and to respond, and I appreciate Dr. Arambula's concern, the bill also does call for the regulatory process may very well be able to, or may still be able to discern the difference between the cost share burdens on different manufacturers and make adjustments accordingly. So it is our hope that as this moves forward and we see how this all comes together, that there be that sense of equity and there be that sense of responsibility. I mean, this is truly a transformative bill on dealing with pharmaceuticals and sharps. I mean, there has never been anything like this. So we have tried to anticipate a lot of those problems and respond, but that doesn't mean we've figured it all out. And what we've tried to do is keep it flexible enough so that we can come back as necessary to address these problems. I would like to say the cost to the generics, the cost of this program is really minuscule. Recognizing that the profit margin on generics is less, that it does relatively impact them a little bit higher, but we are talking about less than half a penny per every prescription. For every prescription dollar, I should say. So it's a very small amount, but we're trying to get the manufacturers and the whole production line to recognize that not only are they out there providing access to these medications and these instruments, they have to take responsibility when they've done with their useful life, because otherwise we don't know what to do with them, and they are a danger.
All right. Well, like everyone's been saying, I think the key here is that we are moving, getting out of the gate and with perhaps the details to be addressed in follow-up legislation or through the regulations that would be developed through CalRecycle. But I look forward to addressing those issues. Thank you.
Thank you.
So yeah, my understanding is that we know the program's going to be paid for, but we don't have the details on who has what burden. And that's got to be worked out. Could you say a little bit more about that process, Senator Jackson?
Well, I think at this point I would like to call upon, in terms of the process, just to make sure that I've got it right. We are looking at CalRecycle to develop the program. And
did you want to bring an expert up?
Could we have
Mr. Schmelzer
to talk about this process?
Yes.
I want to make sure I have it exactly right.
No, I agree. So could you talk about that process? Because that seems to be a major concern of the opposition right now, and I think it's important to discuss.
Thank you, sir. Yeah, and then obviously we make room for the industry. My understanding is, well, not my understanding, period, point blank, there is no cost allocation in the bill. It is left up to private contract between the interested parties. They can either get together and make a decision about how that works, or they can, or there's room for them to comply individually. There is existing precedent for this because of the PPSWG, which
oh wait, PTSWG.
Yes, the product stewardship. What is it? I just use the letters all day. It's the Pharmaceutical Product Stewardship Working Group. There we go. Thank you. Together, we figured that out. And my understanding of what occurred there is that there was an independent process that included, I believe, and again, I'll defer to the industry or anybody else who knows in more detail, but that included an independent kind of almost an administrative law judge, and everybody presented their case on what the cost allocation should be. So all the companies, as we would suspect, got together with their lawyers and figured it out.
They haven't figured it out yet, or?
Well, the PPSWG operates all of the local programs. The 9 existing, and yes, there is an existing cost allocation that was done through an agreement between the companies.
Do we have any idea whether that'll be the same agreement when we go to the statewide process? And then I'll give you a chance to answer.
I think
first,
one of the things we specifically shied away from in this bill was changing that allocation model and letting the industry determine on their own how that should be done.
So it could be changed.
The bill is silent.
The bill is silent, so if people, so there's 9 programs now, and we now have a statewide program. There could be new negotiations on the statewide program. Then you have a concern, I know.
Or just a little additional information, PPSWG was set up to deal with Alameda County.
Mhm.
They're the ones who operate Alameda County, and as you've recognized, there are concerns in Alameda County.
It isn't working well.
As it's continued to take back around the nation and counties have continued to be implemented. PPSWG has grown, but it is a board that's largely dominated by the brand pharmaceutical companies. And part that, yes, as I said early on, the generics did participate in some of the formation, but again, that was developed with the idea that this was going to be for Alameda County at the time. And as it's grown, we don't know if PPSWG is going to be able to continue to grow with it. We don't know if that will be the one entity, or we don't know if each individual manufacturer is going to have to come up with its own program and meet the demands of the state, which is what leads to some of the real cost concerns in the bill for generic manufacturers. And as Senator Jackson mentioned, some of this, whether it's a half a cent per prescription, generics
per dollar.
Per dollar.
It's actually per $10 according to the stipulations of the Alameda County ordinance. It's half a cent per $10. So just to be clear.
Okay, thank you.
Yeah.
Generics are often priced at a penny a pill, period. And generics survive based on volume and the number of pills that are being prescribed. They don't make large margins on any of these prescriptions.
Mm-hmm. Well, I will say, though, that it is based upon price. Is that the actual price or the price that the person is paying at the counter? Which price is it? A half cent per $10.
I'm just telling you what was stipulated in the pharma lawsuit against Alameda County. They stipulated that the cost of the program was half a cent per $10. I'm not sure beyond that. I can get you. I can get you the actual court document if you.
No, but is that the actual cost of the drug or what the consumer pays with insurance?
Yeah, I'm not clear.
All right.
Yeah.
If somebody knows. Okay. All right, then wholesaler, representative, do you want to say something here? No, okay. Do we have another expert?
Sorry,
no?
you were asking me to come up and answer the question about the Alameda court case. I'm Heidi Sanborn with the California Product Stewardship Council, and the drug companies stipulated to the fact that less than a penny for every $10 sold is what the entire program would cost for Alameda County.
Sold. Is that what the consumer is paying, or is that the actual cost of the medication, the consumer's price plus what insurance pays?
That is the actual cost that the drug companies would pay extra. They internalize that.
No,
cost.
but based upon which price? The one the consumer pays, or the one the consumer plus the insurance company pays, or the list price of the drug? What price are we talking about?
I'd have to go back and check. I don't think.
Okay, so we don't have an answer to that. Let's try and get an answer before it comes to the floor.
If I may, generic manufacturers and AAM was not party to that lawsuit or that
Okay,
statement.
I understand. All right. I think we've gone as far in that as we can. Yes, I agree. We need to get to lunch.
Thank you. I'll be brief in closing. Part of the beauty of this is we set out the parameters and we said to the industries, you figure out how you want to pay for this. That's part of the beauty of the program. This is what we're requiring you to do. You come together, you figure out how you want to make this work. So generics and any other parties can set up their own independent plan under this bill. You know, that we keep hearing about how we're trying to stifle companies and overregulate them. Here we're just setting the parameters and saying you figure out how to make it happen. And with that, I would respectfully ask for your support. We'll get you the answer to that. The bottom line, though, is the price of this, the take-back programs is minuscule compared to the profits that these companies make and compared to the amount that's out there, and also compared to the cost. When we have people who come to emergency rooms because they've misunderstood, they get too many medications in their medicine cabinets, they don't necessarily go to the sheriff's department to remove their drugs or to have their sharps sent back. We've got to do something to clean this up. This bill has a wide berth of support. We've worked really hard on it. If we need to make some adjustments going forward, I know that we have that desire and certainly the commitment to do so. And with that, I'd ask for your aye vote.
Okay, so I'm very much recommending an aye vote. We need to get this to the floor. We cannot live with 40, 50 different programs, whatever
More
the number
to come
would
if
be.
we don't do this.
Yeah, exactly, including the County of LA, which is a quarter of the population of the state. This needs to go forward. I do respect the concerns of the wholesalers and the generic drugs, and I am willing to hold a hearing on this early next year, finding out how the cost allocation is done, hearing from our members and others. I think this is, I'm very glad you raised this issue, and I promise you we will follow up on it. All right, with that, Madam Secretary, please call the roll.
This is SB 212 Jackson. The motion is do pass and re-refer to the Committee on Appropriations. Quirk?
Aye.
Quirk, aye. Melendez? Melendez not voting. Calra? Calra, aye. Arambula? Arambula, aye. Bro? Bro not voting. Holden? Muratsuchi? Muratsuchi, aye. So that's 4 votes.
Okay.
It passes.
The bill is out. I will hold this open for Mr. Holden for a few minutes. Say till 1:30. Here he comes. Yeah. Probably in another committee. Yes, no, we will hold a hearing. This is Josh. Make sure you, yeah, well, make sure you see Josh. We'll try and set something up next year. Whoops, I have this microphone on. All right, Mr. Holden, how do you vote? Aye for Mr. Holden, that's 5 ayes. Bill is out. The meeting is over. Thank you all very much.